Okay, so today we're talking about flossing. I've got a patient in, and she's in for something else, but I'm just going to clean up her lower teeth a little bit for her, and we're going to talk about flossing. But just want to share with you basic flossing principles. So when I see, someone says they've been flossing, but then I see buildup between the teeth, a lot of times they just don't quite understand what the goal of flossing is. So when you're flossing, you're wiping the tooth. So underneath the contact of where the teeth touch is where you're going to wipe. So if you imagine if your arm was dirty, sometimes people will take the floss through just straight down and straight up. But the dirt under the contact, if you had dirt on your arm, and you wouldn't rub it like this, you would wrap your hand like this and wipe it like that. So what I'm going to show you is like we call it the C-shape method. And you can use floss picks, you can use string floss, and if you have spaces between the teeth, you can use what we call, interproximal brushes. So I'm going to show you that today, and then you'll have the tools. So next time we see you in August, you're going to look much better. Okay? All right. Perfect. All right. So here, I'm going to show you where we first floss there and rinse that. And you can see the difference. Oops. All right. It's not a good day to drown. So, all right. So some other options. You've got the floss pick, and when you floss with one of these, it's the same principle, but instead of holding the string in your hands, the flosser holds it. So you still want to wrap. So what you're trying to do is wipe this area, and you can see I'm getting a little more plaque there. So wipe there, wipe here, and I'm putting some pressure on it. You come through here like this. You can see the plaque coming off. See that pretty good, Leamber? Mm-hmm. So really, you can get these in a big pack. I'm just going to wipe that off. Open a little wider. And definitely still floss the back of the back tooth. You can see there's some plaque back there. I would normally come from the front here, but I'm trying to make it where it shows on the camera. You can see as I'm flossing, I'm starting, and then as I'm walking it out and then wiping it off. Okay, there's some right there. So now if I'm using my regular floss, it'll just be like this. And then I'm also going to show you in areas where you have some space, floss works fine. You also have the option of using, knocked your hat. That's all right. So you also have the option of, this is called a interproximal brush. Interproximal just means in between. So you can take that brush in an area like this. This one's probably a little large for this. Oh, no. And you just take it in there like this. But you probably use a little bit smaller one just to get in a couple more spots. But when you have these wider open spaces, these brushes work really well. And the name of the game, as far as keeping teeth, is having the least amount of plaque as you can. Let's see. Roll your tongue back. So you can see there, much less plaque. And without plaque, the gum tissue stays healthier. And her tissue is not really inflamed. So some of that, maybe some buildup from a meal. But I just wanted to show our patient. I know she's coming back in a couple of months for a cleaning, but when I see buildup, I just, we like to just go ahead and take care of it if we can. So, but now she'll have this video and you'll have this video, and hopefully it'll help everybody have healthier teeth. Very good. Thank you, Leamber.